Welcome to EduDose, where science meets innovation. I'm Dr. Satish Polshettiwar. In today's session, I'll not only explore quantum dot drug conjugates for triple-negative breast cancer, but I'll also walk you through their detailed mechanism of action, a vital understanding for researchers and pharmacy professionals. Triple-negative breast cancer, or TNBC, is highly aggressive and lacks three key receptors: estrogen, progesterone, and HER2. This limits treatment options, increases drug resistance, and causes high relapse rates. Conventional chemotherapy is systemic and non-specific. That's where quantum dots come in, to deliver the drug specifically and also visualize its journey inside the body. So what exactly is a quantum dot drug conjugate? It's a nanoparticle system made by chemically attaching a cytotoxic drug to a fluorescent quantum dot. These QDs are made from semiconductor materials like CDC, ZNS, carbon, or graphene oxide, and are coated with biocompatible linkers such as PEG, carboxyls, or amines for drug conjugation. Now let's break down how these conjugates work inside the TNBC tumor microenvironment step by step. First, targeted delivery and circulation. Once administered intravenously, QD drug conjugates circulate in the bloodstream. Their surface functionalization, like pegylation, helps avoid rapid clearance by the immune system. They accumulate at the tumor site due to the enhanced permeability and retention, or EPR effect, which is basically the leaky blood vessels around solid tumors. Next, tumor penetration and cellular uptake. At the tumor site, the QD drug conjugates enter TNBC cells via endocytosis. This can be receptor-independent, or it can be enhanced if the QDs are functionalized with specific ligands. Inside the endosome, the acidic pH triggers drug release from the QD surface. This can happen through pH-sensitive linker cleavage, enzyme-sensitive degradation, or even through thermal or light activation in advanced designs. Inside the cell, the released drug, say doxorubicin, gets to work. It intercalates with DNA, inhibits topoisomerase II, and triggers apoptosis through mitochondrial disruption. This means we get selective killing of TNBC cells with minimal harm to healthy tissue. Meanwhile, the quantum dot continues to fluoresce, allowing real-time imaging of tumor localization, uptake efficiency, and drug distribution, all non-invasively, using techniques like fluorescence microscopy or photoacoustic imaging. But how do I know these systems are working as intended? Researchers validate QD drug systems using tools like TEM and DLS for size and shape, zeta potential for surface charge, FTIR, and UV-Vis for chemical bonding, fluorescence spectroscopy for emission properties, and MTT or apoptosis assays for cytotoxicity. So, what's the big advantage here? This smart system offers targeted delivery, real-time tumor imaging, controlled drug release, reduced systemic toxicity, and potential for personalized medicine. If you're planning your PhD or MPharm around this topic, focus on novel QD surface chemistries, optimized drug conjugation strategies, in vitro and in vivo imaging methods, and above all, the biosafety and biocompatibility of QDs. Quantum dot drug conjugates represent the next frontier in nanomedicine. Diagnosis and therapy come together in one elegant platform, true theranostics. Thank you for joining me on EduDose. I'm Dr. Satish Polshettiwar. Like, share, and subscribe to keep learning cutting-edge science simplified for the pharmacy world.
If you found this video helpful, please subscribe, like, and share it with others who'd benefit. See you in the next video.